So I brought my auntie along with their daughter and sons. So just want to help them. Actually, first the patient was at home. She was outside, and then she was doing the gardening. She was plucking some flowers, all those. So, and then she feed the pigs at the same time. So just suddenly she felt headache, but she cannot stand, she fell down. So they carry her to her house, and then they take care of her. So she want a doctor which is quite experienced about this one. So Dr. Sanmeet has appointed here. So we came here last 2 days, and then at the same time only when we reached here in Apollo, they did a checkup, all those, and then they made her go to OT and then do the surgery and all that.
This patient is a 55-year female and who had developed aneurysmal bleeding.
Mrs. Radaya from Khasi Hills, Meghalaya came to us with a acute stroke. Basically, she suffered from a subarachnoid hemorrhage. It is in a rupture of a vessel actually that causes this kind of bleeding. So she is already referred from Meghalaya with the diagnosis. What we did, a repeat angio we have done here. We found 2 aneurysms were there and one active leak from the distal aneurysm from the ACA region. So immediately we admitted the patient. On the same day we did the angio, followed by we planned for a minimally invasive endovascular coiling rather than going for direct surgery, because patient was quite stable at that time and we wanted to do minimum things. So within 6 hours of admission, we took her to the cath lab with our neurointervention team. We performed the coiling successfully, and distal ACA aneurysm was coiled with 3 coils. Procedure was very good.
When she was investigated, she was diagnosed with distal ACA aneurysms. She was successfully treated with endovascular coiling.
And then after that, at that night, she was not quite well. But day after, she was talking to us. She said that she feels fine. And also the operation, I talked to Dr. Ahmed. He said that the operation was successful. So glad to be here that.
And successfully we performed the things. She shifted back to neuro ICU, and then the next morning she shifted to the ward, and today we are planning to discharge.
So this endovascular intervention techniques can be used for treating various diseases like aneurysm ruptured, brain AVM, dural arteriovenous fistulas, and many other diseases like carotid stenting for carotid plaque, carotid stenosis, as well as for acute ischemic stroke for mechanical thrombectomy. The advantages of endovascular intervention is the patient can be discharged very early, even on the next day on foot, and with very less mobility and mortality.
So now actually we planning of discharge her. She was successful with her operation, all those. So thank you very much to the hospital, to the doctors, to the nurse who's been with her, supporting her. Thank you very much.